Hi, everyone, and welcome to the Muslim Sex Podcast. Thank you so much for tuning in. I really appreciate your patronage, and I would love it if you could leave me a 5-star review because that really helps me. And if you could like and share this episode with somebody that you know that may benefit, your friend, your colleague, anyone, I'd really love you to share this podcast, especially if you find value in the Muslim Sex Podcast. Also, I'd love for you to subscribe to my YouTube channel and follow me on all my social media. Also, as you probably know, if you've been listening to this podcast, is that I have a practice that is now open in Chappaqua, New York. I see patients for menopause and sexual health, as well as regular gynecology. So if you are looking for a gynecologist that actually spends time with you, that has time to listen to you, then I would invite you to come and see me in my practice, and I'd be more than happy to take care of you. So make sure if you live in the New York area, or even if you don't, come and see me in my office. I'd love to meet you. And also, last but not least, is that I am hosting again my retreat in Morocco for 2025. So if you are looking for a gift for a family member, a friend, yourself, make sure you take a look at our retreat, the Love and Nourish Retreat. It will be held September 19th through the 26th, 2025. Again, this year in Morocco, we will be visiting the same towns. We will be in Marrakesh and Essaouira. And as always, we will be providing information and lectures on menopause, perimenopause, nutrition, and also going for cooking classes as well as excursions. So don't miss out. I know a lot of people were sad when they missed out this past year on the Morocco retreat. So make sure that you go and visit the Love and Nourish Retreat hosted by Caria Retreats. And now onto the episode. I am an American board certified ObGyn, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about menopause and all the different treatments available and all the exciting things happening in the forefront. Before I get into it, the first thing I want to make certain is that this is definitely not any type of medical advice. So if you have any questions about menopause, perimenopause, sexual health, any of those things, definitely be sure to go speak with your healthcare provider. And as always, this is not meant to be any type of religious advice. So if you have any questions about your religion, please speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So I am so excited to have on with me today Dr. Suzanne Gilberg. Yes, and it's hyphenated.
Well, yes, TBD. It's technically hyphenated, but I'm going to go back to Gilberg just to confuse people more.
All right, excellent. So Dr. Gilberg, I would love for you to, for those people that may not know who you are, for you to introduce yourself and let us know where you're streaming in from, and also a little bit about your background.
Yeah. Well, first of all, thank you so much for having me on the pod. I love it. As you know, I'm weighing in to say I love the name. Okay. That's vote of one, sample size of one. I am board certified in obstetrics and gynecology, and also have training in integrative and holistic medicine, specifically Ayurveda, and a real love for indigenous medicine, traditional medicine, plant-based medicine. I think we'll talk about that, but I mean, that's medicine, right? That's where conventional medicine didn't like fall off a tree and like there it was magic, 80 years ago, 40 years ago, whatever. Like it's just another iteration of what humans have done the entire time we've been on the planet, which is try to figure stuff out and stay healthy, right? So I have kind of a really interesting, more broad and deep background. But I'm board certified in ObGyn. I only do gynecology, and I do focus a lot on perimenopause and menopause, but I still do full scope gynecology here in Beverly Hills, California. I went to medical school at USC during the height of the murder and violence epidemic here in Los Angeles in the 90s. We had the highest murder rate ever at that
Oh, wow.
time. So it was a
No.
pretty intense experience. And then I did my residency in ObGyn at Cedars-Sinai Medical Center, which I think probably sounds like it was the opposite, but at the time had a big public program as well. And I've been in practice here for 25 years.
Wow.
I'm an author. I founded something called the Menopause Boot Camp to sort of fill the gap in knowledge. Women didn't understand what was going on. And I created a program here in Southern California and then wrote and published a book. HarperCollins published the book in 2022, right as the wave of menopause awareness was cresting. It was kind of
I see.
interesting.
Yeah.
Yeah. And I've done media work because I'm in LA for my whole career and wound up appearing on the Drew Barrymore Show and then being asked to stay on as a crew member. So I'm there frequently to do a lot of I'm their chief medical correspondent. So that's really fun. And
Exciting.
that's what I'm doing. I opened a new practice, a concierge gynecology practice here in LA in January. And that's just amazing. I'm having such a great time, loving medicine again, falling in love with medicine again.
Yeah.
So I do a lot of things, but I love educating and speaking. I really do.
That's amazing. I love all of that. That's so fascinating. Yes, I love concierge medicine too because you actually get the time to spend with patients, which is huge, right? In traditional medicine, you just don't have that. You have what, about like 10, 15 minutes?
At most. I mean, you're booked for 10 to 15, but you probably are double booked.
Yes.
At the end of December, when I was winding up my practice, I was seeing 27 plus patients a day, which is just crazy.
God.
It's really not for me, especially with the kind of work that we do where we talk about sexual health and menopause and hormonal changes. And really, I want and need to know who you are as a whole person.
Yes.
That just takes time, and insurance does not value our time. It values volume.
Yes. Absolutely. Absolutely. And so it's hard to get to know what a patient is really there for, right? They could be coming in for, somebody says that, oh, they're coming in for some vaginal pain, but you find out that they're, in the middle of a divorce and they're actually, having an affair and there's so many things, right? Like in concierge medicine, you actually get a chance to get to know the patient, get to know what's going on, to find out what matters most to them and what they want to focus on and where they want to put all their energy and this and that. So I agree with you 100%. There's so much teaching and education that goes on, right? In the concierge space, which I absolutely love as well. So let's go back to you and tell me more about, so what are the different modalities? And when you see a patient in your practice now as a concierge doctor, what is the process that you take them through?
Well, I mean, they fill out a lot of paperwork, which I go through. And so it really does allow me to take a magnifying glass to their history and really dig in and have the time to understand not just like the obvious stuff, which, by the way, as a practicing physician, I know this, like there's always something they forgot that they did, like a huge thing they forgot to tell you, which when you have 45 minutes, it's oh yeah, I forgot to tell you like all these hugely important things like that you didn't fill out, which is fine. It's the analogous to, when you do your annual visit and the doctor gets to the door, our hand is on the door and we're just like saying goodbye. And then that's when the real question comes out, which I fully understand where that's coming from. People are just like, how to like get the nerve up to say what they needed to say. So I can really dig into their history. Like, for instance, one of the things that people don't always realize is that if they've been pregnant, their pregnancy history is really, really important for their long-term health. They don't always know that. So I can get a really thorough history, get to know who they are, what their goals are. And then I can collect a lot more data to help them understand where we can go with that. So for instance, the one thing that I've added right now, I'm going to do a lot more lab testing going forward, but I have a body composition scale, which is fantastic. So no one wants to get weighed. It's not about the weight. I don't even go over the BMI or the weight because honestly, that's trash. What I can tell them is I can look at their overall fat mass, specifically their visceral adipose, because this composition scale shows me how much is around the organs. And then I can also look at their skeletal mass, where it is, because it'll show me torso, right and left upper extremity, right and left lower extremity, arms and legs. So are they symmetrical? Where is their weight? It compares them to age and frame match controls. It's really, really useful because then we can look at it and say, because listen, I'm in Beverly Hills. Not that nobody cares about this, but I just had a conversation with another person about this 2 hours ago. Many of my patients come in midlife concerned about their body changing, their
Yeah.
weight changing. What does it mean for their health? And also, what does it mean for how they feel about themselves, their
Mhm.
self image, which, by the way, will impact their sexual health too. And
Absolutely.
when I can look at this and show them, well, actually, you're in the 93rd percentile for skeletal mass. You are doing all the right things, and your visceral adipose is actually quite low. So here's what we know. You don't like the muffin top. I don't like my muffin top either. And how can we work on that, right? Or, oh, you know what? You're slim, you're fitting in your clothes, and it turns out your adipose tissue around your visceral organs is actually much higher than we expected. So how can we work on that? It helps us have a realistic perspective on what's actually going on with them, and that may shift some of their health setting goals. And it gives us some long term, we have a longer runway, because as you know, this is going to be managed by lifestyle, by mindset, maybe by hormones, maybe by other medications, by supplements. Now we can get into your gut, your genome, all these other micronutrients. And I mean, I could go on and on because I'm obsessed with this stuff and I
Yeah.
have the time to do it. And people are leaving with a smile on their face because
Yeah.
they're not like, oh my God, what is going on? I don't feel right. Or I feel gross, something's wrong, but I don't know what it is and there's no plan. We can make an individualized, personalized plan that's based on what's really going on with them and based on evidence.
Yeah. Yeah. That's amazing. I mean, that sounds very, very thorough. I'd love to hear also about, I know that there's in the past, there's, some doctors that advocate for, like, let's say psychedelics to help women as they go through menopause, perimenopause. I'd love to hear what your thoughts are on that.
I mean, this is something I'm really just dipping my toe into, although it's obviously an extension of my interest, my long term interest in herbal medicine. So, I mean, in LA, I think the joke is a little bit like everybody's microdosing, right? So, first, let me say I'm not a psychedelic practitioner. I don't prescribe. I'm not a psychiatrist. I'm not a neuroscientist. And mushrooms are not legal in this country, sadly, because I think that that particular psychedelic is really powerful. Mushrooms in general are super powerful. We know that they have a lot of impact on immune function, on brain function, but the science is really in its early stages because psilocybin, particularly the psychedelic mushroom, is a controlled substance and it's not legal. It turns out there are a couple of labs in the United States that are sanctioned by the DEA to do research, and I'm and medical advisor for a company that is involved in that research. It's very exciting. But we know that psychedelics have very powerful impacts on mental health. We've seen it work very well in PTSD, depression, anxiety. And, our friend Kelly Casperson likes to remind us that libido is a mood.
Mm-hmm.
Sex, interest in sex is a mood. And I actually had an amazing conversation yesterday with a phenomenal, he's really a sex researcher, Jim Faust. I'm going to be interviewing him at International Society for Women's Sexual Health conference later this month in Atlanta. And so we had an initial conversation. He's a big researcher in the human sexuality and also in psychedelics. And we talked about that. The data on brain impacts, on growing connections, for instance, on neuroplasticity is there. I think the way it could be applied to sexual health is sort of TBD. There's some studies more looking at when we impact mood positively, it turns out we also are impacting sexual functioning and interest in sex. So I think this is an area of great prospect. I think there's a lot of interest in it. We're obviously in a moment where who knows what's going on with research. And I think, women's sexuality we know is different. It's also hormonally mediated. So some of that impact on the brain, knowing that there's a lot of hormone impact on the brain, like Lisa Mosconi has been, showing recently, for instance, loss of estrogen receptor activity in the brain during the menopausal transition. So how do these things interact with some of these other molecules that we know, the psychedelics, are having an impact on things like dopamine, serotonin? I'm fascinated by it. Cannabis is another area where there's some interesting data as well. And I'm interested to sort of see where that goes.
Yeah. Yeah. No, that it definitely is fascinating. There's so much there with what you just talked about. So, with sex being a mood, I agree with that. I mean, we know that the biggest sexual organ is the brain, right?
Right.
And we know that our mood is controlled by the amygdala, by the hippocampus, all of these things, right? All of these structures in our brain. And we know also when estrogen goes down, our mood is affected. And also, we have, increased anxiety and depression during perimenopause, menopause as our estrogen levels go down. So, that
And
can
progesterone has a big impact on that too.
on the mood.
Yes,
Yes.
definitely. They're GABA. Progesterone occupies GABA receptors, and if you look, I didn't mean to interrupt, but like
Yeah,
I've
yeah,
seen
yeah.
observationally, and I think there's some data to support this, and it's also why some of the herbs that I use I think are effective for mood and perimenopause. One of the things that's happening, you're right, estrogen is declining. Actually, in perimenopause, estrogen is cuckoo town.
Right, right,
Low,
right, right.
low, high,
A
high. It's
roller
all
coaster.
over
Yeah,
the
roller coaster. Yeah.
but progesterone is being produced by the ovaries, by the
Yeah.
follicle, and we know our ovarian reserve is declining and the
Yes.
quality of the egg and the follicle is declining, which means you're making less progesterone in the second half of the cycle. And I'm
Right.
sure anybody who treats perimenopause and menopause sees, especially in early perimenopause where maybe the cycle hasn't changed a lot in terms of the bleeding pattern, but all of a sudden somebody is having like a PMS at ovulation and a PMS before their period, or it's extending for the entire 14 days, or you've skipped a period and now it's 40 days of feeling like crap. Specifically, and anxiety and panic seems to really increase. And I think a lot of that is really progesterone mediated because progesterone has a calming effect. So I think when we understand the physiology of what's happening, that's where we can make an intervention that is
Yeah.
specific to the person.
Right. Right. Absolutely. Yeah. And I think that that's also where, it's really important that when women are going through all these changes, right, that they see somebody that understands that, because
Yes.
then otherwise they become victims of polypharmacy, where they go to one person, a physician that they give them antipsychotics or antidepressants, and then they go to another person who's treating them for something else. And then they just end up with all these medications. Right. So really
Yeah, and
important.
medications to treat the side effects from the medications, and then,
Yeah.
and just
Yeah.
not understanding globally what's going on. You're so right. I think it's very hard. It's very challenging for us because we've already noted doctors who really care and are motivated to help don't have time. They
Yeah.
certainly don't really have a ton of training in this area. They don't have a lot of support. And patients also want a fix. They want
Yeah.
to use their insurance. They want to come in. They want to get in. They want to get out. I know you've seen the stats on, it's like a big X, right? So
Yeah.
as the Women's Health Initiative came in, and something
Yep.
like 40 to 45% of women were on hormone therapy at that point, plummeted down to almost zero. And what was released at that time was SSRIs,
Antidepressants.
antidepressants, and
Yeah.
that, is the ascending arm. Neither of us, I know, is here to say that antidepressants are terrible. Nobody should use them. We love them. It's a
Yeah.
tool in the toolkit. But when your toolkit is limited and you don't have all the tools available, you're not going to be able to apply the correct tool to the correct job. And I
Right.
think for your listeners to understand and be empowered, you may want or need an antidepressant. But if it wasn't explained to you that this may be related to your perimenopause and your hormones shifting, you're not getting the full picture.
Right. Right. And I think something else that you just mentioned is that, taking medications to treat the side effects, and then those side effects have other medications they use to treat those side effects. And I think that that's really, really important. We know that with antidepressants, it can affect our libido. It can
Yes.
definitely affect orgasm as well. Right. And then we know that no, what I want to know, actually, I want you to tell me what you think about marijuana, because when I was looking up marijuana for women, it says that it may help them,
Yeah.
right? It
Yeah.
decreases their inhibitions and it may help them with orgasm. But with men, it actually causes an opposite effect. It prevents their orgasm. I'm wondering what you think about that.
Yeah, I mean, I'm not a male sexual health
Right,
specialist, but
right.
I think there's also a really big difference between chronic habitual use and like focused use, right? Application, and I mean that's a really interesting thing. I know that Lauren Stryker presented some more data. It wasn't like an analysis, but it was just sort of a report on people's reported use, women's reported use of cannabis products for sexual health, and it's a
Yeah,
huge number of people. And we know people are using it for sleep, for mood, gummies, edibles, now that it's like legal almost everywhere. And I'm not against it, but I think it would be better for us to understand how this works. The data is not amazing, but I'll tell you what we do know. We know that, first of all, the human body has something called an endocannabinoid receptor system. Our body actually makes receptors for this plant. How
Mm,
interesting is that? That's
yes.
because we evolved, who knows really, but I mean, we evolved with the plants. And
Mhm.
these are indigenous medicines that were used. This was sacred medicine in many cultures. But we have a really high concentration of receptors in the pelvic girdle. So we
Mm,
have a lot of sensitivity to occupation in everywhere, whether it's the musculature. So, could it be good for pelvic floor dysfunction and pain?
mhm.
Yes. Um, we have it in the vaginal and clitoral and vulvar tissue. So, again, decreasing pain, decreasing inflammation, increasing sensitivity and pleasure. So, and people have, I mean, anecdotally, we hear a lot of topical use can be pretty beneficial, but also you nailed it, like the disinhibition, which is probably part of the way psychedelics work. Disinhibition allows people to be more receptive and turn off their executive
Yeah,
functioning. Honestly, like, sex is a mind body experience. If you
yeah,
are phoning it in and you're like making your list and who's picking up Johnny at soccer, and did he take the trash out, like, you're not in your body, and you're just not going to be present. You're not going to enjoy it.
yeah,
Forget intimacy. You're not there, but you're
yeah.
definitely not going to enjoy it. So you do have to be joined in body and mind. And so some of these medications decrease the inhibition and allow you to be present. Again,
Absolutely.
intentional use, right? And understanding where it's coming from. The other thing is, if you have pain because of
Mhm.
pelvic floor dysfunction, tightness, laxity, whatever, and genitourinary syndrome of menopause, right? So the estrogen loss in the vulvar, vaginal, clitoral tissue, I mean, forget it. We got to fix that first.
Yeah, yeah, absolutely. When you talk about that disinhibition, I know we were just talking a little bit about marijuana. I mean, absolutely right. We know that the sexual response system is based on the dual control model, right? Where we have the inhibitions, we have the inhibitory, and then we have the excitatory. And so when you alleviate some of the inhibitions or the inhibitory side, it's almost like a seesaw. So it's going to allow you to be more receptive to sexual stimuli. And again, that happens also from that human sexual response cycle that we know from Rosemary Basson, that talks about how you need to be, at least responsive to that sexual stimuli. And for that, when that happens, then you're able to proceed with, the arousal. And if the arousal comes before desire, and most of the time it does, especially in long-term relationships, and then that can lead to physical intimacy, which then leads to emotional intimacy, and then the circle continues. And that's why I think that when women have, a lot of times when women are born, not born, but like raised in very conservative communities, they have a lot of sex negativity.
Yes.
And
Yes.
they believe that, sex is wrong, it's dirty, it's shameful. And so they need to go from that sex negativity to almost a place of sex neutrality,
Yeah.
before they can go to sex positivity, so that they can be responsive to sexual stimuli. And I think that there's, a lot of work there that has to.
Enormously important. So any tools that we can use, I mean, listen, just naming it and being visible around it and saying it out loud to
Yeah,
destigmatize is so, so, so powerful. But it is true, and I've seen it over the years working with patients, 25 to 30 years of working with patients. And in Los Angeles, we have, every kind of person, and lots of people from communities where exactly that. There was a lot of shame, a
yeah,
lot of control. I mean, and just doing a physical exam, a pelvic exam, is really, really challenging for these people. So
yeah,
working through the trauma of that, making space for somebody to not be ashamed, making just a space, the 15 minutes they're with me, where it's like totally a normal thing, right? That is a foundation that people can build upon. But some of these medications can really move people forward in another direction. And there's some really interesting work in the psychedelics community around, specifically around intimacy. There's a therapist here in LA named Kat Meyer, who's accrued quite a large database on couples and individuals and their use of psychedelics in reestablishing intimacy, and actually reestablishing almost like bodily autonomy, which is maybe, I feel like people think it's going to be like some crazy out of control experience, but when you're using these medications in a guided experience with a knowledgeable practitioner, it can be very, very healing.
Mm. Yeah, no, absolutely. I've had a couple of these discussions with a few practitioners that do psychedelics, and that's what they talk about. They say that it's really like depending on what type of psychedelics they are,
Right.
but they can be really an out of body experience, and you really have to be with somebody that knows
Oh,
what they're
yeah. Oh,
right.
no, you're not going to go like buy shrooms from the guy on the corner. Not that you would. I hope you would. Certainly not advocating that.
Yeah, yeah, no, absolutely right. I mean, there's definitely, and it's done under a very controlled
Oh,
environment from
yeah.
what I understand. And what she was telling me that it helped her with, a lot of the trauma in the past and just kind of moving forward. And I think that that's really important, especially for, individuals that have experienced a lot of trauma, a lot of
Yeah.
either childhood trauma or child abuse and things like that. Really
Yeah.
important for them to, overcome that so that they can move forward in their relationship. So it's
Yeah.
really important modality. I'd love to hear more about. So there's another phase of you. You're such a busy woman. The Drew Barrymore Show. Tell me how that happened.
Well, I mean, look, I've been practicing in LA for a long time, so you tend to fall into media randomly. I think the first time I did any kind of media work, I had a patient who was like on a reality show and was
Oh,
pregnant, and they were like, "Hey, can we come in and film?" And I was like, "Sure,
yeah.
whatever." You know what I mean? And I mean, there's like a whole backstory here, which is not that interesting, but just like very random. I mean, I was introduced to one of the now executive producers of the Drew Barrymore Show maybe 20 years ago. Somebody I knew who is an actor. He was looking for a doctor for a show that they were producing, and she didn't tell me, but she said, "Oh, you should meet my doctor. She's really funny." That was really what happened. And he called me and said, "Hey, I want to have coffee. I heard you're funny." I was like, "I'm sorry." I mean, I'm really paraphrasing. And we had a great conversation and a lot of ideas. And they were casting for a show, which I did not understand, Sadaf. I really didn't. I was like, I'm a doctor. Like, I was like, okay. They were like, can you come and meet the team? And I was like, sure. I had no idea it was actually an audition. And I was meeting like the entire executive team at Warner Brothers. I had no idea. I was totally clueless. I was like, chill. I was like this. They green screened me. So I think people know what that is now. But at the time, because everybody does it on TikTok, they put me in front of a green screen and just asked me questions. And I just went, and they freaked out because didn't care about the camera. And it started from there. So, honestly, just like any other industry, producers were like, oh, we worked with her. She's fun. She's easy.
Yeah.
Like, I'll call her. When my book came out, I had stayed in touch with this man, Jason Kurtz, amazing, amazing producer, has produced a lot of the beloved daytime shows that you all watch. And we'd stayed friends. And when my book was coming out, I said, oh, my book's coming out. And he said, oh, well, you have to be on the show because Drew is like entering perimenopause and obsessed. And can I just tell you something? This is 2022. And I had been doing media for years. I knew a lot of people. I'd done a lot, whatever, every show you could think of just for fun.
Yeah.
And I could not, and I had a really good book PR agent. I had a legit book. It was HarperCollins. This is no offense to anybody who self-publishes. This isn't some self-published Amazon bestseller. This was like HarperCollins bought this book for me. We had the hardest time getting me on daytime shows.
Wow.
Podcasts, everybody got it. No issue. And I had been in the wellness world for a real long time. So I had some credibility there. People knew who I was. But Drew Barrymore was the only big daytime talk show that wanted me on. And I did this show, and it was an enormously highly rated episode because nobody was talking about this yet.
Right. At that time, yeah.
Nobody. And I happened to be in New York, and Elisa Volkman from The Swell, which is where you and I met in person. I don't even know how she knew me. She and Naomi Watts, but it was her, stalked me because I was supposed to go to Chicago to do a TV spot and a radio spot for book promotion. And she was unrelenting and said, we're doing this event. There's never been anything like it. We're gathering all these experts. We're gathering media. It's so important. Please, please, please come. And finally, I was like, oh my God, I don't know who this woman is, but I'm going to do it. And I went, and it was a completely life-changing event. I met all of you guys. I met Kelly Casperson, and I were on a panel together. I met Tamsin Fadal. I met all sorts of people that I was following or didn't know, and everybody started connecting. And honestly, this is the origin story for the Menopause, because we all kind of met around that time. And also, we were in a room with people who really cared about this.
Yeah.
And it was the most beautiful experience for me in terms of my practice, but also professionally, because I had spent 20 something years swimming upstream, really feeling like I believe in what I'm doing. I know it's a little bit different than everybody else's focus, but I know it's what people need. And the
Yeah.
patients knew that, but I didn't have, frankly, a ton of professional support. And for the first time, I met other doctors, women, who we weren't competitors. We were collaborators. And it has
Yeah.
been the most beautiful experience of my career in the last 2.5 years to serve the public, grow this conversation, bust down doors, bust through ceilings, open windows, shout to the masses. I think being locked down in pandemic, I think post Me Too, I think these, and I think Gen X hitting this time, it was a sort of a convergence of events that created this incredible opportunity for everybody to rise together. And it has just taken off. I've met so many incredible colleagues. Um, the TV show has been a really, really fun, gratifying part of it. I'm not going to lie. Like, my next episode's going to air, I think, in the next couple weeks. And I was on set with Naomi Watts and Brooke Shields and Judith Joseph, who's an incredible psychiatrist who works in this field as well. And it was weird. I mean, I was like, what is my life? It was so fun. So fun.
It's
Who would think
amazing.
you're going to have all these ladies in their 50s open about it? Drew's the baby of the group. I think Judith is too. Just being open about our stuff and sharing and again demystifying, destigmatizing. I mean, Brooke Shields was an icon. Like, we're the same age. She was our
Right.
icon growing up. Her role cannot be underestimated because she's done this before. She did it
Yeah.
with postpartum depression, being honest. So the opportunity, is it fun for me to go to New York? My daughter lives there. I have friends there. I got some hair and makeup. Yes. Is it amazingly gratifying to be on TV in front of 3 to 5 million viewers and teach them something that's really valuable and evidence based? Yeah,
Wow.
that's pretty gratifying.
That's amazing. Yes. And you are changing so many women's lives. That is fantastic. I mean, just the impact, right? And just talking about it so openly. There was a time when nobody talked about menopause, right? Perimenopause, menopause, sexual health. Nobody talked about any of those
Yeah,
things. Definitely not out loud and definitely not in public. I mean, the things that we say now that we don't really, we're almost desensitized to, other people are still very shocked about, if we mention words like vulva or vagina or things like that, right? Clitoris, all of those things, people are very shocked. But I think that we live in kind of like this this universe of our own where we're
yeah,
just we feel very comfortable talking about those things, and it's just because these things are so important. And I think that there needs to be people that talk about it so that women don't feel alone, right? They feel like there are others that are going through this as well.
absolutely. Listen, and it's been a journey for me as well because you go into OBGYN for the reasons you go into OBGYN. I went into it because I loved the soup to nuts approach. I really loved the relationship. I loved medicine, but I loved surgery. I mean, it's a very specific kind of person. Like, you and I know, even if you don't do OB, like, we're not for everybody.
We're
It's
not.
like
We're a little intense. We're intense.
a lot intense. We have to be because it's like nothing is going on until it's a conflagration. It's insane. Which
Yeah,
that's why there for me was a limited lifespan on OB. Although I did do it for 22 years,
I'm
but
still doing it, unfortunately.
it's huh? Yeah. Oh, you're still doing it. Oh my
Yeah,
God.
I
God
said still
bless
doing.
you.
That's what I said.
God
Unfortunately,
bless you. I'm older than you, I think. But anyways, but we didn't learn about sexual health and
no,
sexuality. And I
no,
remember literally, I really,
no,
really distinctly remember early in my career being like so embarrassed and blushing, I think, to like ask questions. But I'm like, you have to ask these questions. Or like, and I would have a way I'd be like, talk to them when I'm doing the exam so we don't have to be face to face kind of thing.
yeah,
Now I'm like, whatever, I'm an old lady. I've been doing this for 25 years, but that's not how it started. And I think, and the reason I'm saying that is like, look, your doctors are human beings too. And we have our own stuff we have to work through too. And when we do the work, we're much better clinicians. We're much more open minded. We understand your struggle, your stigma, your shame. And I think being real and authentic is one of the most important tools in the healing toolkit. Like,
yeah.
if I look and present perfect, I don't know, I guess maybe you're aspiring to that, but to me, that would just feel not real. And like, can I really say what I need to say to her? Is she really going to get it?
Yeah.
I'm
Yeah.
imperfect.
Yeah. No, absolutely. And I think that, it was, I think it, for us as gynecologists, right? Like we don't learn anything in medical school. I mean, what, maybe we learned an hour of like Masters and Johnson
Right.
and definitely we learned the physiology, right? A
Yeah.
little bit.
Yeah.
But
Not
I
a lot.
mean,
Yeah, but a
you
little.
know, right. And I don't remember learning very much else outside of that. And then, in residency, we learned how to, deliver a baby. We learned how to do surgery. We learned how to, detect cervical cancer and this and that. But we just don't learn like sexual health. We don't learn. I mean, I didn't learn anything about perimenopause, menopause. Forget it. There was nothing, right? The
Yep.
WHI came out and everyone threw
Right.
away their estrogen the next
Right.
day, and it was bad, and it gave everyone cancer and blah blah. And so you just didn't learn. I mean, I didn't know anything at all. So it's everything that we learned now regarding these topics. It's like we had to figure it out ourselves, right? We
Yeah.
had to
Yeah.
learn and do our own research and find people that are talking about this all the time so that we can stay on top and we can stay, we know so that we can then teach our patients. Otherwise, how are we going to all move forward?
Well, that's exactly right. I mean, science is not a fixed monolith of truth.
Yeah.
Science
Yeah.
evolves all the time, and we call it the practice of medicine because we are continually learning more. I was very fortunate. We had a nurse practitioner in my practice. And even that, we had an administrator who was like, you know what, you guys, I think we should bring it. She herself had been an RN and had and administered practices for many years. And she came in very experienced. And she introduced the idea to us. This is like probably 2006 or so. And she was
Mhm.
like, I think we should bring a nurse practitioner. And I think we need more help in the office. I think it'll relieve you guys. And she brought this really, really experienced nurse practitioner who had been at UCLA for years, older than us and super smart, had done OBGYN for years, right? And she and I became good friends. And she said, hey, do you know about the International Society for the Study of Women's Sexual Health? And I was like, no. She said, I think you should come with me. I'm going to go to a week long conference training. And I was like, okay. I mean, literally, can I tell you how many times in my career I've done stuff like that, just like on a lark? And it's changed my life. And I went with Dale Perry. Thank you, Dale Perry. And I reconnected actually with one of my really close friends, Michael Critchman, who had been my chief resident. And he was, he's really important in the field and in the international community. And I learned, and my mind was blown
Yeah.
because even a lot of the vulvar pathology and all this stuff that you really don't have a lot of time for often in your training, you're kind of
Yeah.
like in clinic, boom, 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 on labor and delivery, doing surgeries all day. I was in a very high volume practice of residency. So I did a lot of stuff, but
Yeah.
like this kind of granular stuff, which is what you see in clinic, I didn't really learn. It
Right.
was mind blowing. And I was like, oh my God, sex. Yeah, we got to talk about it. So that was how I started doing it. And it was really, Ishwish was in its infancy. It was maybe, I think they're celebrating they're almost their 20th year in existence.
I know.
Maybe not even, maybe 18 years.
It's
So
amazing.
yeah.
So,
And it was
so
because
you found
they
out.
were willing to push forward.
Yeah. So when did you join Ishwish? You said
I mean,
2006?
this might be 2007, 8, something like that.
Wow. Amazing.
Yeah.
Yeah. I didn't even, that's amazing. I had no idea about Ishwish until 2021. I would say 2022 when I started the course with the University of Michigan on sexual counseling and education. I did that year-long course and I didn't know anything. I mean, you really have to make that concerted effort if you're
Yeah.
interested in a certain field, especially in medicine. I
Yeah.
mean, especially because we don't get it. And so you do have to find those societies and
Yeah.
if somebody tells you or if you do a course or somehow, but I don't know. I feel like we need to do better outreach so that more people know about it because it
Yeah.
is such a fantastic group, right? I didn't realize that
Yeah.
you were part of
Oh
it
my
for
God.
so
It's such an
long.
amazing group of practitioners who are really bold, so evidence based. I mean, they're
Yeah,
so evidence forward and very,
right.
very intentional about making sure things are evidence based. But it's also like, I mean, it's a fun group of people. I mean, of
Yeah,
course,
it is. It
who's
is a
going to
fun.
do that? Like,
Yeah,
you
yeah.
know,
Right, right. I mean, right. I think again, you have to be a certain kind of person, I think, to
you
be able
do.
to talk about sexual health and make it fun and exciting. And, I think sometimes what happens is that when you start to talk about sexual health, people start to sexualize you, which I think is really it's a very strange kind of relationship. And I think that, you have to, I don't know. I think that it takes, I think, a certain kind of person, I think, to kind of separate that so that people don't start to sexualize it. You know what I'm saying?
Or
Like,
yeah, or like use that as a reason to not take you seriously, which is why
yeah,
I think they've done it the right way in terms of really being evidence forward and like tons of poster sessions,
yes,
a lot of science.
yes,
It's really taken they take themselves seriously, and I think the only
yeah,
way that we get taken seriously is we just continue to be like, I take myself seriously. You want to check it out, great. You don't. I mean, I'm at a point in my life which is also very, I think, very postmenopausal on brand. I'm like, listen, I'm here for you. I'm not here to push it. You don't want to hear it. I don't know what to say to you. Like, this is your lot. But I will
I
tell you, it's interesting. I had a conversation with my former senior partner, who I've known since I was an intern, and he is an older white man. He's an incredible doctor, wonderful surgeon, good human being. And it was interesting. We had a conversation like last week. He said to me, I'm so happy for you that you're really doing what you want to do, and I'm proud of you. And he's like, but he said, for me, it's very hard for me to talk about some of this stuff. I have to be unbelievably careful. And honestly, he was sort of saying, like, I just don't, a third rail, I don't want to go there because
yeah,
the environment now, the way it feels to
yes,
me, is unsafe. So I'm going to leave it to the younger people like you, even though I'm not that young, but I'm younger than him. And I really understood where he was coming from. I
yeah,
did. He does
yeah.
need to tread lightly. I need to tread lightly too. You said it, but woman to woman, it's different.
It is.
Yeah,
It is. And I think that, right, it may seem a little bit odd for perhaps your, I don't know, your male gynecologist to be talking to you so freely and openly about sex. I don't know. I think it just really
and yet
depends
we
on
have
the
a
person.
lot of really major leaders in the field who
Yeah.
are older white guys, because
Yeah.
that's who the leaders in the field were anyways. But I mean, and I don't know, that's a really interesting question. I would love to ask them kind of like, how are you affected? I think if you're in academics, maybe it's a little, you're more protected in some way. This is such an insider conversation, but it might be interesting to your listeners. I mean,
Okay.
maybe there's more like guardrails up for them. I think in private practice, like, you
Yeah,
just have to
right.
be
Yeah,
really, really careful
I
about how
agree.
it's going to be taken.
I agree. Yeah. 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 But I think that, and that's why women come to us
Yeah.
because we're so wonderful.
Yeah. Well, and I think you and I are out there like doing public education. And so people
Yeah.
already know, like, okay, this is a person who's devoted time and study. She cares about it. She feels safe to me. I don't know. There's,
Yeah.
and women do need to take care of women. We already talked about that. Women
Yeah.
do need to take care of women. There is a place for every great physician and clinician on the planet. I don't care what you look like, what your gender identification is. But I think the reality is women have been harmed, and
Yeah.
women need to feel safe, and women can talk to each other in a way that is very specific.
Yeah.
I'm a
I think
cancer survivor. I don't need to be treated by someone who had cancer. But when I have a conversation with another cancer survivor, it's like a whole other thing. They understand it.
absolutely, right, and they get you, right, and they feel that you understand them because of everything, that you understand and that you have personal knowledge of, right?
Yep.
Just as when women come to me and they say, I have a male gynecologist that I'm talking to about menopause, perimenopause, and they tell me that, I just need to deal with it, or they're not willing to give me hormones. And then they feel completely dismissed
Yeah.
because first of all, they think like, well, he's a guy. What does he know anyways? And secondly, he's not even willing to listen to me. So that's why, again, that's why they find us
Yeah.
because
Yeah.
we are willing to listen to them, but also because we're going through it or we've been
Yeah.
through it. And
No, totally.
we understand. So absolutely. So
My
for
gray hair is helping in this situation.
yeah, absolutely. You look fantastic.
Well, thank you.
So really quickly, I'd love for you to tell me, I know you have a retreat. Is it already sold out? I know you guys are going to Portugal. I'm so
It's
jealous.
not sold out. We still have some availability. And yeah, I'm so excited. So Dr. Corinne Mann and I, who really I think should be acknowledged as the leader in speaking out loud on social media and educating around breast cancer and menopause. I mean, she's just brilliant. She and I are leading a retreat for on menopause and breast cancer. So this is for survivors, people at high risk, clinicians in Portugal in June. And I believe until the end of March, there is the accommodations, which is at the Ritz-Carlton in Sintra, Portugal. will be included. This is going to be a first of its kind event. I don't think anybody has done anything like this. It's going to be a combination of really like advocacy and education, but like luxury, rest and retreat. I'm going to bring some integrative medicine, and we're going to do like a nature walk where we talk about what local herbal medicines can be made there. We're going to talk about the evidence. And then we're doing at the end a day-long symposium for clinicians who treat and want to learn more about treating breast cancer survivors, because one of the things that's happened in the menopause conversation is that the breast cancer survivors feel really left out because they've been told you can't use hormones. And it's a lot more nuanced of a conversation. And we really want to, and there's, 4 million, I think, breast cancer survivors in the United States right now. It's a very large group of people. So we want to open this conversation up. Really, it's truly a retreat where you're going to get taken care of, but also learn. So you can do a link, or you can look at my socials and find that. But so I'll put that out there. But we would love to see people there.
Amazing. That is fantastic. So, I hosted a retreat actually last year in Morocco with Dr. Basma Ferris. We did it. It was focused on menopause, perimenopause, and sexual health.
Oh.
I did those lectures. And then Dr. Basma Ferris did the lectures on nutrition, because she did culinary medicine, and she's like the president of culinary medicine right now. And so anyway, so we did like food. What did we do? We did cooking trips. We also went to like a olive oil farm.
Yeah.
We went to Argon Farm, and it was fantastic.
Wow.
It was really great. And I did a lot of sex coaching there for the women there, and it was fantastic. So I love retreats. I think it's fantastic. I'm so glad that you're doing one for breast cancer.
Great. So great. I have a bunch of other ones. If you join my email list, it's going out. I think the email with all the retreats coming up this year will be in there, and everything's on my website too. But I'm going to have a lot of retreats the second half of the year. And I love doing that. I love having that conversation ongoing with people, having dinner with them, getting to know them. Like I said, when I started, I love talking to people. Yeah. That's what keeps me going.
Yeah. It's fantastic. I love retreats too. They're amazing. So for all those people that are sitting here watching and they're like, gosh, she is amazing. How can I work with her? Where can I find her? I just want to stalk her everywhere. Not stalk in a bad way, but follow her.
In a good way. In a loving way.
Yes.
In a not in
a creepy way.
Right. I mean, I think probably going to my website is the best, because all my socials are linked there. So that's Dr. Suzanne, TheDrSuzanne.com. And there's information there. I think maybe my link to my new practice is there, but you would need to see me locally in Los Angeles if you want to be a practice member, but I'd love that. And I love engaging. The truth is I'm mostly on Instagram personally. So I love it. Thanks for mentioning that. And I would love to meet any of you at any time.
All right. Amazing. Well, thank you so much, Dr. Gilberg, for coming on and spending your time with us and sharing your knowledge. And we're so excited about all the work that you do and all the advocacy you do. And it's so fantastic to see menopause coming out, but also all the effort and time that you've put into promoting menopause. So I'm so grateful to know you and to have you on this podcast. So thank you so much.
Oh, thank you so much, Dr. Lodi.
And well, we are done here, and it's been real and really intimate. And again, this is not meant to be any type of medical advice. If you have any questions about your health, please speak with your healthcare provider. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.